Is that a higher number than other parts of the
No,
country?
that's similar.
It's very similar.
The rest of the country is similar.
Okay, so we won't see, we're not on some
No
priority
special list.
No.
No, it's all of us.
Yeah, okay, so and when do you have an idea of when this
We
is gonna
think
hit?
the vaccine, we're told as of this week, and I want to emphasize everything I've said here today except for the basic epidemiology could change. We hear new information hourly. Right now we're expecting vaccine first week in October. It will probably start with the high priority medical positions like the OBs and the pediatricians and the hospitals. Then we expect to move into the schools and offer vaccine to the schools hopefully by mid-October. And by the general population, I would think sometime in early November.
And again, the vaccine is a choice.
It is absolutely a choice. Getting the flu is not fun. And if you have underlying health conditions, it can be dangerous. So everybody has to make their own choice on this. It is definitely a choice. Nobody is mandated to get it, but we want to make sure it's available to anybody who wants it.
Great. Anything else you want to let people know about that's going on, things that you guys are doing?
Well, I want to re-emphasize that if people are concerned about the vaccine, there is a ton of information on the websites. This is a very safe vaccine. It is similar to seasonal flu vaccine. It's made the same way. It has the same kind of virus base in it. There should be no more risk in taking this vaccine than the seasonal flu vaccine. The studies have all come back clean and good for this vaccine. It's been approved by the FDA. So I encourage people to not be concerned about this as some kind of strange and new vaccine. It's a normal vaccine. And so should get it.
Well, great. Now, anything, if folks do have more questions, how would they get in touch with?
Well, you can Google Berkshire County Boards of Health. I'll say the website, but it's a hard one. It's bcboha.org.
Berkshire County Boards of Health Association.
That's association.
Don't forget the A on the end.
That's right, bcboha.org. We also, the DPH, Department of Public Health, has a great blog.
They do.
Yes. And they have a website, and so you can Google that up, and it's very accessible information, and of course the CDC has tons of information too. So this is not one that you can't get the information if you want it. There's plenty of stuff out there.
It's out there.
Yeah.
Sandra, thank you so much for being with me today, and good luck
Thank you.
in your work.
Can't say I'm looking forward to it, but we're going to do our best.
Well, good luck.
Thank you.
Thank you. And welcome back to the show on the H1N1 virus. I'm State Representative Denis Guyer. Joining me now is Jim Wilucz, who's the Health Director for the City of Pittsfield. And Jim, welcome to the show.
Thanks for having me.
Yeah, thanks for being here.
It's a pleasure.
Now, as the Health Director, just for the folks at home, what do you do, and what's your role? And
I think the question is, what don't we do? We do all the administrative work, enforcement, prevention measures for the City of Pittsfield under the guidance of the Board of Health, which is chaired by Dr. Philip Adamo. And what we're focusing on is prevention. We do the routine food service inspections, the housing inspections. We have a blight issue that we're dealing with, and very well under this administration. And the new role that we're working on is trying to get the word out for the H1N1 and what we can do to prevent and how to maintain our core essential workforce so people aren't home throughout the season sick.
That's great. And in this segment today, we're going to talk about how the H1N1 has specifically hit, or we think might hit, Berkshire County.
Yep, absolutely. Unlike the seasonal flu, the H1N1 is a little bit different. With the seasonal flu, we're really concerned about our senior population. They're the most vulnerable. The H1N1, it's the opposite. We're actually working with the children. They're at the high risk, with the median being around 14 years old. We really took a proactive approach back in March and April. We disseminated out a lot of information to the public, the schools, the daycares, the workforce, and anyone that really are in part of this strain of the H1N1. And we haven't really had a lot of cases in the city of Pittsfield.
Well, how many have we had countywide?
Countywide, I'm not sure because I only oversee the city of Pittsfield. But Pittsfield, we had 2 confirmed cases, which it's not surprising. I think the seasonal flu, we have more cases than H1N1. But I hope that those numbers are low because we're doing the prevention and getting the word out.
Is it possible that other people have had it in the Berkshires, they just didn't realize they had it?
It's possible. The seasonal flu and the H1N1, they have the similar symptoms. And at the beginning, they were really testing for the H1N1 so they can develop the vaccine. I think over time, the testing in the laboratory became very expensive. And so what we're doing now is if you have the similar symptoms, we're going to treat it as an H1N1. So I think in the state of Massachusetts, I think there was about 1,400 cases. I think today it's 1,403. So it's pretty. I don't think it's that bad. But moving forward, there's going to be some funding coming down through DPH and Berkshire County Boards of Health Association, so we can hire nurses and get volunteers and really take a proactive approach. So when the vaccines do come, we are prepared to give these vaccines out to the target populations.
That's great. And so what are some of the local resources that people have available to them?
There's a lot of local resources. We're working on a master plan for the city of Pittsfield, and we're collaborating with all the other boards of health in Berkshire County. And the school departments have really stepped up. Jake Eberwein has a bunch of school nurses and volunteers and parents that want to really work with us to administer the vaccines. You know, there's limited dollars of actual paying people to do this stuff, and I think we're really in this together as a community, and I think a lot of people have really stepped up. Retired seniors, we have retired nurses, just everyone's really coming together as a collaborative approach to really deal with this issue. There's no borders in public health. Every community is in it together. It's not about Pittsfield, it's not about Lee. We're all on this on the same page, and we all are put to task to really try to get the word out and to send a message that everyone needs to be calm. The H1N1's been around for a few months. We're working on plans, and we're really prepared to deal with this on a local level. And as long as we get the information out there, universal precautions, wash your hands, cough into your elbow, and stay at home. And I know at the beginning stages with the H1N1, when it first came out, I was getting a lot of calls from employers and employees calling and saying, well, you know, I don't really have a really good sick policy. I get 1 day off a year. And once I really educated the workforce in Central Berkshire, I said, look, what are you going to do if 40% of your workforce is at home with the flu? So you really need to work with your staff and employees, really work with them. If they're not feeling well, stay home. And there's always been that old past rule where people do abuse the sick policy, and but really at that point in time where the H1N1 is here, and we really have to manage it and prevent it from spreading. So we have to work together, employees, employers, and the community as a whole.
That's great. Now, you guys are working, the Pittsfield board is working with other boards in the region, communicating about how to best educate the public?
Absolutely. Through Berkshire County Boards of Health Association and the Department of Public Health with Commissioner Auerbach, Pittsfield is the biggest community, and we are a fully staffed health department and a fully staffed Board of Health. 3 out of the 5 members have medical backgrounds. And we've really took the lead role in Central Berkshire, and we've really opened up that welcome to other communities that are either willing to join us, because other small towns don't have as many resources as we do, but it's a collaboration of an approach. We've really tried to set up 3 separate coalitions, one in North County, one in Central, and one in South County, to take the lead roles to help the other smaller communities.